probably the most common type of chart we see. The y-axis is still something quantitative like the count or rate or percent of something, but in this case the x-axis is often something that's qualitative like race or ethnicity, religion perhaps, or some ordered categorical like a scale from lowest to highest. There can be vertical bars in bar charts, which is what you usually see, or there can be horizontal bars in bar charts, which you don't see often, and it's actually an underutilized technique. Bar charts can be simple, just one set of bars. They can be clustered, they can be stacked, or they can be 100%. Because of time, I'm not going to cover all of these types of bar charts. This is a simple bar chart here showing immunization rates in Alameda County as an example. And you can see sort of quickly that the immunization rates in these kindergartners are a little lower for African Americans, the first bar, than they are for Asian Pacific Islanders, the second bar. Here's another simple bar chart showing chlamydia rates by age in California, and you can see quickly that in the 20 to 24-year-old age group the rates are highest, for example. This is a clustered bar chart now where I'm not showing just total chlamydia rates, I'm showing rates by age. And you can see that at every age group, females have higher rates of chlamydia than males. And for explanation on that, contact the STD control branch and we'd be happy to discuss it with you further. Now this is just sort of one click on any piece of commercial software where I can change it from being a clustered bar chart to a stacked bar chart. The problem is rates are not additive. Rates don't stack up, and you can not just add the rate in males to the rate in females and get the total rate. You have to use a different technique. So I'm showing you a type of thing that should not be done, and throughout this talk I have a few of these don't signs because you just simply can't stack rates, and therefore you have very low or useless data integrity for those particular figures. Here's one, however, where the stacked bar is appropriate. This is showing back to syphilis, where we're showing the number of syphilis cases in half-year intervals in California among men who have sex with men. And the last bar, for example, you can see that the numbers have increased, clearly, by looking at the height of the bars. But the bottom bar is the proportion of the cases that are HIV positive. So you can see that of the syphilis cases, 63% were HIV positive in the most recent half-year interval. So obviously a very important public health issue. Pie charts are another common type of chart. And I want to mention that Dr. Tufti says they should never be used. He thinks they have very low integrity for a number of reasons, but I don't quite agree. I think they are very familiar to most people. They're easy to understand. And they're effective if used carefully and sparingly, in my opinion. Here's an example of a simple pie chart where we see the distribution of the California population by race and ethnicity. And it's easy to see very quickly that population is white, a very small proportion is Native American, etc. It's a quick communication of that piece of information. Maps are another important type of chart. This is a so-called chloropleth map or thematic map in the terminology of the GIS field, or Geographic Information System field. And in that type of map, some geographic region, in this case counties, you plot a particular quantity, in this case the rate of Lyme disease. And because this is broken up into counties, it really invites you to ask questions. You certainly see quickly the higher rates in the Northeast, high rates in a few other areas, and it causes you to sort of look, where am I, what are the rates like, and what are the rates like where people that I know live. This is another chloropleth map, in this case showing rates of obesity by state in the United States. And I'd like to highlight that the dark blue you don't see dark blue on this map, but dark blue is greater than 15%, and the yellow is less than 10%, and white, there's no data available. But this is 1985, and we don't see any states that have greater than 15% obese. I'm going to click through here and show you some other years. 1986, 87, 88, 89, 90, getting a little heavier, 91, a few states now greater than 15%, 92, 93, 94, 95, 96, 97, 98, 99. So by 1999, the overwhelming majority of states have greater than 15% of the population obese. And the way I went through those, you know, tells quite a story. You can present a table, you could talk about it, but it really works to have a visual display along those lines. So as I mentioned, there's many other types of visual displays and some hybrid types, and I'll mention just a little bit about those. With a couple of quick clicks on sort of commercial software, you could end up with this so-called donut chart. And basically, this is a useless type of visual display. There are some extremely unusual situations where perhaps it would be beneficial, but I can't think of too many. Furthermore, rates don't work this way. You cannot make rates into a pie chart or a donut chart. You can't tell what's going on between the genders here. So this is an example of a very, very poor visual display that should not be used at all. This is an example of a hybrid where we have a map showing some regions in California, and then a bar chart showing the increase in MSM syphilis cases in each one of those regions, highlighting that this problem we're having in syphilis is occurring throughout the state, not just in the big urban areas like San Francisco and Los Angeles, where a lot of attention to this increase has been. This is another hybrid chart where we have bars and lines combined, and we have two different y-axes. The y-axis on the left is the number of cases of measles. The y-axis on the right, corresponding to the line, is showing vaccination coverage. Data integrity is a very important aspect of visual display, and it's the notion that the data are presented honestly and clearly. This is a visual display that some of my good friends and colleagues at the California Office of AIDS have used in some presentations they've given. And I want to draw your attention to the line that is noted with the red triangles. That line is showing the proportion of cases in each year that are Hispanic. In other words, among all AIDS cases each year, what proportion of those cases are Hispanic? So I'm going to go forward once where I'm just isolating on that one line, so you can see more clearly that the proportion of Hispanic AIDS cases is increasing. Okay? The issue here in terms of integrity, it's true that it's increasing and it's important, but this next slide is showing the number of AIDS cases among Hispanics. And here we see that since the early 1990s, the number of AIDS cases has been going down among Hispanics. So if all you see is this, the proportion, you somewhat are led to believe that the problem is increasing in an absolute sense. And it's not. It's really increasing in a relative sense. This is the first slide I showed you where you can see now that the proportion of non-Hispanic white cases is decreasing, and that's in part what's responsible for the percent increasing in the Hispanic cases. And what actually is going on is the number of white cases is decreasing more rapidly than the number of Hispanic cases, so the percent of Hispanic cases is increasing. It's still important that more cases are Hispanic in recent time periods, but it needs to be put in this context of decreasing numbers. I've mentioned a number of things related to knowing your audience in slides previously and some slides to come. This chart, which is a chart that a colleague in my office prepared recently, is showing the percentage of California women who report douching by race and ethnicity and age. And what this chart is showing is that here, for example, African American women have higher rates of douching and they go down with age, whereas in the other racial and ethnic groups, the proportions are lower and increase with age. And this figure is a complex figure that was very useful for us to look at this important issue of douching, but for many audiences it would be just too much
and there's too much packed into this one graph. So it's not at all too complex for one audience, us epidemiologists in the STD control branch, but it could be too complex for a general audience.
This is the chart that I showed you before in terms of immunization rates. And this is another treatment of that in terms of knowing your audience. For some audiences, I'm going to go back up. This is a simple, clear chart that most audiences can handle just fine. But for certain audiences, something like this where it's boiled down even further. A couple of bullet points highlighting the key features, acute human interest infant there to keep your attention on it, and a much smaller treatment of the graphical display itself may be the way to go for certain audiences.
Well, that finalizes the first part of the presentation. I hope you enjoyed it, and I hope you join us for part 2.